A guy once confided in me about the huge cost and lengthy treatment he has endured because of gonorrhea. It got me thinking, he's probably just one out of many with similar experience. To avoid a story like this, I'll put together everything you need to know about gonorrhea. You're welcome to my channel, Ask Nurse Malik. If you have not subscribed to this channel, make sure you subscribe, like this video, and comment your question under the comment box. Today we are going to talk about gonorrhea. Gonorrhea is a bacterial sexually transmitted infection caused by a bacteria known as Neisseria gonorrhoeae. It is curable, but the bad side is that it may leave the victim with serious long-term complications. This complication may arise if it's not well treated. Then, what part of the body exactly does gonorrhea affect? Gonorrhea affects warm and moist areas of your body, such as your vagina, your urethra, your throat, your eyes, your anus, and other parts of the female reproductive tract. Then there are certain symptoms that you will see or you begin to notice if you have this gonorrhea. What are those symptoms? Usually, the symptoms of gonorrhea may take several days to weeks before it develops. One of the first symptoms usually experienced is painful urination and a burning sensation. However, we have some gender-specific symptoms. The symptoms you may see in men is discharge from their penis, and it may appear green, yellow, or white. They can also have painful testicles, swollen testicles also. Then the symptoms you can see in women is they have lower abdominal pain, they have abnormal vaginal discharge, which is usually yellow or white in color. They have pain during sex, that's when they have sexual intercourse, they have serious pain. They can also bleed between periods. Then how does this gonorrhea transmit from one person to another? What is the mode of transmission of this gonorrhea infection? Number one is when you have vaginal sex. Yes, gonorrhea is a sexually transmitted infection, so it can be transmitted through vaginal sex, anal sex, oral sex, use of sex toys in between sex, manual stimulation, that is when you engage in fingering or licking. Then you can also have it from mother to baby during delivery, that is if the delivery is not well done. Gonorrhea can be transmitted from the mother to the baby. Then when you have contact with infected areas or people who are infected, when you come in contact with their body, these are ways you can get gonorrhea transmitted from one person to another. Then who is at risk of this condition? You see, people with multiple sexual partners, they are top notch. People who have had gonorrhea before, it's possible of recurrence of this gonorrhea infection. People who have had other sexually transmitted infections are also at risk. People whose partner has other sexual partners, as you have a partner that have other multiple partners, you are at risk. Then people who just meet a new sexual partner, you are at risk. So if you just meet a new sexual partner, you need to get yourself tested, get yourself screened for any sexually transmitted infections before you go into sexual intercourse. Then the young people, the adolescents, the people who are into puberty, they are also at risk. Then what are the complications of this gonorrhea infection? In men, you can see complications like infertility. They can have inflammation in the testicles. They can have prostatitis. They might have scars on their urethra, which can cause them pain during urination or pain during sexual intercourse. They can also have epididymitis, that's inflammation of their epididymis, that is under their scrotum. Then we also have some complications in women such as PID, that is pelvic inflammatory disease, that they begin to have serious pains in their lower abdomen. It can also result them to ectopic pregnancy. Infertility can also arise from this gonorrhea infection. You see, their unborn baby may be infected during childbirth and experience an eye problem that may lead to blindness, the one we refer to as ophthalmic neonatural. That is blindness of the child following delivery, which means the mother might have experienced or might be at risk of this gonorrhea infection. Then how do you prevent this gonorrhea? Number one prevention measure you should take is the use of condoms. When you make use of condoms, it can help you prevent it. Then use of dental dams for oral sex. That's for those that involve in oral sex, that is oral sex. You understand? So you make sure you use your dental dams to prevent this transmission. Then avoid sharing of sex toys. For those that use sex toys to stimulate themselves, to stimulate their orgasm, make sure you avoid sharing of these sex toys with your other genders. Then host a gender party with one partner who is willing to stick with hosting it with you. Not as if you host a party that everybody makes sex with everyone. No. When you hold a party or when you host a party, let everybody have their genital party to their partner alone. Then screen yourself regularly as well as your partner. Make sure you go for tests. Screen yourself for any possible sexually transmitted infections and make sure your partner is also screened from those infections. Then how do you treat this gonorrhea infection? The good thing about this infection is that it is a sexually transmitted infection of bacterial origin and it is curable. So based on your symptoms and severity, your doctor will prescribe appropriate medications and recommend lifestyle modification for you. So it is important to note that the symptoms of gonorrhea look like symptoms of other infections. So if you experience or notice these signs of gonorrhea, don't drag your feet. Kindly visit the nearest health facility to be tested and be screened for the sexually transmitted infection, also be treated. Don't forget to carry your partner along. He or she should be tested and be treated too. So till we meet again in our next video, don't forget to subscribe to this channel, like this video, and don't forget to ask your question under the comment box. Thanks.